I have given birth twice. First time with epidural, and the second time zero drugs, completely natural and unmedicated. And I'm here today to share with you guys the details of everything, like every single detail. So this is going to be a very TMI video. I'm going to share you how I felt, the sensation, my thoughts during labor, the delivery pushing part, and immediately right after pushing, what happens, like what, all the stuff that happens afterwards, immediate postpartum, my postpartum recovery, and if I were to give birth again for the third time, whether I would go with epidural or without epidural. Sorry, my hair is like extra crazy right now because I'm just trying to, film real quick while my son is napping. So quick disclaimer before we get into this, there is no right or wrong way to give birth, like whether you want drugs or without drugs. I am not here to advocate one over the other. I think they're both great options. I'm just here simply sharing the truth, all the details about what it was like giving birth with epidural and without epidural. Before we get started, per usual, please subscribe if you're new here. Welcome. I would love for you to join me here. I post motherhood and lifestyle content videos here. Hit that bell notification so that you'll know when I post a new video. And if you find this video useful, don't forget to give this video a thumbs up. Let's talk about contractions. So for first time mom, you're probably wondering how am I gonna know when I'm in labor? Will I know? Because trust me, I asked the same question my very first time. At first, it'll feel like menstrual cramps, and then gradually it will build up over time, like the intensity and the pain level will increase gradually. So the contraction is just muscles literally contracting to push your baby down, and the pain starts from your lower back and it kind of just radiates up towards the front of your belly. So that's what it is, contraction in a nutshell. So I just wanted to throw that out there because whether or not you get epidural, you will feel some contractions before you get admitted to the hospital. So most hospitals will only take you in, get you all admitted if you're in active labor, and that'll be 4 centimeters dilated, and you'll probably be experiencing contractions prior to that, so whether or not you get epidural. So when you get epidural, it's like a huge long needle. Hopefully that didn't scare you. They don't show you it because they don't want you passing out or freaking out, and they also don't let your support person see it either, because again, people have, they get all woozy and they pass out from seeing a long needle. Before administering the epidural, they give you lidocaine, which is a numbing agent. They give you lidocaine in your lower back area, and it just feels like a quick pinch. Doesn't hurt that much, and then once that lidocaine kicks in, they'll give you the epidural, and you don't feel the pain when the epidural is being administered. It just feels like a lot of pressure in your lower back, but that's pretty much it. So if you're getting epidural, they also will start an IV for you. That way they can administer any additional drugs if necessary, like Pitocin, to aid the process of your dilation, and also to provide fluids for you through IV. You will only be on a liquid diet. Some people get nauseous from epidural, so that way they don't want you to throw up and all that. So once the epidural kicks in, it usually doesn't take long. For me, it took 5 minutes and I was completely numb waist down. So because you're numb waist down, they also have to insert a catheter for you so that they can express urine out of you because you can't walk to the toilet and relieve yourself. And with epidural, you don't feel the catheter at all. There's no pain in the catheter insertion or removal. We'll talk more about the catheter later. Once you get epidural, you probably feel a little pressure, like your baby's making its way down, but there's no actual pain. So they'll also give you a booster button. If you start to feel pain, contractions, then you can just hit the button and it kind of releases out I don't know what the exact dosage is, but they kind of release a little bit of extra epidural in so that you don't feel any pain. Once epidural kicked in for me, my state of mind was super chilled. I took a nap. The nurse would come by and wake me up, tell me to flip over to my other side to even out the epidural, because gravity, you don't want just one side of your body to be numb, so they'll make sure to come and rotate you back and forth. But overall, chill. Once you're 10 centimeters dilated, then you're ready to push. So again, you're still numb. The pushing process, so easy for me. It only took about 20 something minutes for me to push both of my babies out, with epidural and without epidural. So there's really no pain. I only felt pressure, the urge to poop pretty much was a sign that I was ready to push this baby out. Let's talk about pushing. So you only push, basically hold your breath and push as hard as you can during a contraction. So when you're not having a contraction, that's like your time to take a break, like a quick breather in between. So you only push when you're having a contraction. But because you're numbed up from the epidural, you don't feel the contractions, the nurse and the midwife or OB or whatever will monitor your contraction chart and tell you that you're having contraction. Now it's time to push, and then they'll tell you when your contraction's over to stop. So although you're numb waist down, you can still push internally. Like you can still feel the need to push. So my biggest tip, this is also what my midwife told me what to do, to push as if you're taking like the biggest poop of your life. And honestly, I think that's how I was able to push both of my babies out within like 20 something minutes. Like I've had friends who push for 3 to 4 hours. Both like with epidural, and my other friend without epidural, like they push for several hours. I wouldn't have the energy to do that. But anyways, that's just a tip for you. Push as if you're pooping. So I guess I'm good at pooping because I was able to pop my babies out within 20 something minutes. During the pushing part, I did not feel the baby come out at all. Like no pain at all. It's crazy. I didn't even feel her head come out. Like the crowning part is what they call it. Crowning usually is the most painful part because that's when their big old head, babies come out with big heads, all right? They're all like big bobblehead. Their head is coming out. They're pushing out your vagina opening, stretching it out. So usually that's the most painful, and they call it crowning because their head is like going through and like a crown, like just going through. But anyway, so that's usually like the most painful part when you're delivering, but I didn't even feel that at all with epidural, like completely numb. The only part that I sort of felt, maybe my epidural was wearing off, but I just felt like a big pressure, like just her entire body when she finally, my final push, when I pushed her out, her entire body just came out. I kind of just felt like a sense of relief, like the biggest poop just came out of me kind of thing. So, but other than that, no actual pain. So my state of mind during the delivery part was so relaxed. I was having a conversation in between my contractions. I was laughing because someone said something funny, like totally chill. So immediately after the baby is out, you're also gonna be pushing out the placenta, which is a piece of cake because it's a lot smaller than your baby. So I did have a 2nd-degree tear and I had to get stitches, and again, I did not feel anything that she was doing down there. And then they also removed my catheter, also didn't feel anything. So epidural was great in terms of numbing completely everything. However, after giving birth, I felt extremely tired, like fatigue, but also like drowsy. So I'm not sure if that came from the epidural. I know epidural is made up of several different drugs. I think fentanyl might be one of them, but whatever it is, like it kind of gives you like a drowsy effect afterwards. But then again, I'm not sure if that could be it. It could be several different factors. Being a first-time mom could be it. I had a long labor, so I was, haven't slept for like a couple of days, so that also could be another factor. But I felt very, very tired, but I also could be very sensitive to medication. So although the epidural wore off and I was able to walk, I still had this tingly, numbing feeling in my legs for about 2 weeks after giving birth. Also postpartum recovery wise, once the medication wore off, like I felt so much pain down there. Like I know 2nd-degree tear is, a big factor of all the pain down there, but it was extremely painful. Like it was hard to sit for long periods. Like it was just hard to walk around, hard to stand. Like it was just difficult in terms of recovery time. Very, very painful. And another con about getting epidural was the amount of fluids that I received. I don't remember how many bags of fluids I got, maybe 2, I'm not sure, but I was so swollen leaving the hospital. I was swollen for weeks afterwards, like everything, like my face, my arms, my legs, my feet, they were so swollen after giving birth. For like a whole month afterwards. So I was just like a big balloon walking around. All right, so unmedicated. Again, contractions, like we said before, contractions are contractions. Going through labor, like, early active labor, transitional labor, it's painful. I mean, I'm not going to sugarcoat it. Contractions aren't fun. but our pain levels could be completely different. Like on a scale from 0 to 10, 10 being the highest, my pain level of 5 could be like a 10 to you, like excruciating, unbearable pain. Or my 5 could be like a 0 or a 1 to you, like, you know, this is like a little tickle to you or something. Once you dilate towards like 10 centimeters, the, you know, frequency and the intensity does, you know, get kicked up a notch. So it was painful, and I was crying, you know, just like crying softly, not screaming crying, but like crying softly to myself, like just trying to breathe through it. But if you can control your breathing, it does help make it more, you know, manageable. Just like deep breaths in and out during a contraction. So let's talk about the delivery part, the pushing part without drugs. If you don't have epidural, you'll feel every contraction, so you'll know yourself when to push and when to take a break. So don't forget, whether or not you get drugs or not, just push like you're taking a big poop. And if you poop on the table, it's totally okay, okay? I did it for both babies, and, you know, like I said, TMI video, but whatever, I don't care. Like, modesty out the window. Like, these people have seen it all. If you need to poop on the table, just poop. It's really simple. All they do is whoop, wipe it down and keep it going. So I felt every contraction was just painful. I also felt my baby move down the entire time. Yes, the muscles contracting to literally to like push your baby down during each contraction. So I felt every contraction. I felt the baby like inching down slowly over time. So I felt it all. So I just felt like this big bulge part of my body just like slowly going down, 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 down. So lots of pressure, like a big bulge just trying to make its way downtown. It felt really weird. I mean, it was painful, but it also felt really weird because it's just weird. Like, you just feel this like human basically coming out. But it also felt good at the same time because it was like a huge relief that this big bulgy thing is finally like, you know, exiting my body. And this time I had to hold my own legs up because my legs weren't numb, so I was able to hold it myself. But during the delivery part, I kept like straightening my legs out. I don't know, maybe I was tired, I don't know, I just kept straightening my legs out. Or I was also scared, like, no, I don't want to push this baby out. So I kept straightening and closing my legs. I don't know, that was what happened. And they kept telling me like, no, you need to pull your legs back towards you while you're pushing. But yeah, my state of mind during this pushing part was not relaxed at all. I was just being a big crybaby, okay, because it was painful. And I was holding on to the bars, I was like pulling the sheets, like it was painful. Like, I don't know, I wouldn't say a pain level of a 10, maybe like a 9, but yeah, it was painful. And I also think I was kind of getting worked up mentally because I was scared. I didn't know how it would feel like giving birth without epidural, because I've never had, you know, I've only given birth with epidural. So at the same time, it was also fear of like the unknown. So I kind of worked myself up more than I should have, I think. But nonetheless, it was painful. And the most painful part is the crowning part, like I mentioned earlier. This is when the big ol' head finally pushes through the vagina hole. And what I felt was what they refer to as the ring of fire. Yes, it felt like a burning sensation because your vagina is literally being like stretched out, like torn, like it just feels like a burning, like a ring of fire. Yeah, so I get it now. Thankfully, I only had a 1st-degree tear, which is so much better than having a 2nd-degree tear. Only a little bit of skin tore, but that's it. My muscle didn't tear, which I also think because I was able to feel everything, I was able to control it more so that his head would come out slower, versus when I got an epidural, I didn't feel anything, so I just pushed and she kind of just like plopped out and like tore faster. So if you're able to control it, it minimizes the tear because you're gradually stretching out instead of like psh. But yes, but after that like burning, stretching feeling, his head was out, the rest was so much easier because, like I said, they all come out with big old heads, like big bobble heads just like coming out of your vagina. So once the head is out, the rest was so much easier. It was still like not fun. It was still painful and I felt everything. So after he's out, you actually still have contractions after pushing the baby out because you need to push the placenta out. The placenta was obviously much easier, but still not fun because I'm still having contractions right now, although the intensity level has like gone down a lot, so it was a lot more manageable, but still not fun. And I was pushing the placenta out, but my midwife also helped me get the placenta out, and I felt her entire arm up in there trying to get the placenta out. Yeah, maybe she was like elbows deep, I don't know, but I felt it, and she got the placenta out. I also felt the umbilical cord just like hanging down there loosely. Yeah, felt it all, just flapping and hitting my legs, and the pushing part was done. Hallelujah, I made it, I survived. So because I had a first-degree tear, I still needed a little bit of stitches. So I got a little lidocaine to numb the area. I felt the lidocaine. It was like like pricks, like it's a needle. Yeah, they numb you. So apparently the lidocaine helps numb the area before they start, suturing you up. But I felt every stitch that was performed on me. I don't know if you guys are aware, but like the stitch is like, or maybe because I just know this because I used to work for an oral surgeon, but the needle is like a curved needle. I felt the curved needle puncture through the lips, like the labia, every single one of them. I felt her puncture the needle through, and I felt the suture being tugged, and then again, and it kept repeating. Again, not as painful as pushing a baby out, but it was not pleasant feeling at all. So yeah, so I thought I was good. I thought I was in the clear. I thought I was done. No more pain. We're good. Nope. I actually had IV hooked up because I needed fluids because I was feeling a little woozy during labor earlier. So they did give me IV, which, IV is nothing to me. Like I get, my blood drawn, all that stuff, like no big deal. Because I had all that fluid in me, it was time to go pee, and I was also not numb because I didn't get epidural, so I was able to, get up to go to the bathroom myself. I sat on the toilet, and I felt the need to pee. I know I have a full bladder, but I was not able to pee. Oh my gosh, like that feeling, like you just sit there, like you need to pee, but you just can't release it. Like, hello, pee, like, why aren't you peeing? So an hour goes by, I would go to the bathroom again, still cannot relieve myself. Like, I could not pee, but I felt the need to pee. So it's not good to have a full bladder for that long because then you increase the risk of having UTI and all these other infections, and we don't want that. The only way to remove my urine, because I couldn't pee, was to insert a catheter. And, I've had a catheter before with epidural, but this time I don't have epidural. Oh my gosh, like this, I would say the pain level, I don't even know. It was just as bad as the crowning part when giving birth. Like, I don't know. Okay, catheter is like a small needle that goes into your pee hole. Your pee hole is very, very tiny. The urethra, is it the urethra? I think that's what it's called. But anyways, your pee hole is very, very small. And this needle, they can't do it fast. They have to do it slow, nice and slow. And they have to insert it like a few centimeters into your pee hole. And then the pee starts, coming out into the tube that they're collecting. But, oh my gosh, like, I don't know how to describe it. Just a needle going to your pee hole. Hurts like hell. So not everyone has this issue. My issue, I don't know what it was. It was some kind of urinary incontinence or urinary retention where I couldn't release it. Maybe that area was just so stressed out earlier from giving birth that my nerves and all that stuff haven't gone back to normal. Like several hours later, I was fine to pee on my own after they helped me the first time. Apparently it does happen. It's not that common, so I don't want to scare you guys off and say that you'll need a catheter if you don't get an epidural. Then removing the catheter was also not fun either. Same thing. They just pull it out. It wasn't as bad as it going in, but yes, pulling it out was still not fun either. So overall, giving birth without drugs, I would say the crowning part and the catheter insertion were the worst, pain. And yeah, like I said, you might not need a catheter, so it just depends. My state of mind wise, this time around, obviously I was not relaxed. But then again, like I said, I think I was also very fearful of the unknown because I didn't know what it was like, and I kind of did work myself up a little too much and didn't control my breathing. But yeah, that was the pushing part and immediate postpartum. So in terms of postpartum recovery, it was so much easier this time around. I don't know if it's because it's my second time or maybe because I only had a first-degree tear, so only the skin got torn. I was able to sit for long periods. It didn't bother me. I was walking around totally fine. And I also didn't feel lethargic. I mean, yes, I was tired because, you know, giving birth is tiring, but I didn't feel drowsy or lethargic or sluggish after giving birth without any medication. So I did like that a lot. I just felt like I had more energy and overall just not that much pain down there. And I didn't have that like numbing feeling in my legs like I did when I got epidural. So in terms of postpartum recovery, I'm all for the unmedicated part. It just felt much better. So if I were to give birth for the third time, would I go and ask for an epidural or would I go without epidural? There are some factors in this. If I have a fast labor again, like the second time, I will probably go unmedicated. Even though I would be very afraid of the whole catheter part again, but every birthing experience is different. Every person is different. Every pregnancy is different. It's always different. It's never the same, every time. So I'm hopeful that if I were to give birth again, I would go unmedicated just because postpartum recovery for me was so much more pleasant the second time around. Like my legs weren't numb. I didn't have a tingling feeling. I much rather deal with the pain giving birth for like 30 minutes to an hour than deal with like pain for over 6 weeks with during postpartum recovery. Because I already experienced it, I think my thought process would be a lot more calm and like just more like not as discombobulated and able to organize my thoughts and relax a little more the next time around if I give birth without medication again. Once my son was born, like everything that just happened, like all that pain from giving birth, the catheter, really does become a blur. And just enjoying, my new bundle of joy after all that pain. So yes, if I were to give birth a third time, I would totally try unmedicated again. All right, so that's all I have for you guys. Again, I hope this didn't discourage you in case you were thinking of going natural and unmedicated. Every person is different, and like I mentioned before, our pain level tolerance can be completely opposites. So don't let that discourage you for all the details that I've shared. Just wanted to be honest and transparent with you guys and talk about things that not that many people talk about. And if you want to go and get epidural, that's great as well. If you want like a more relaxed, calm environment, you want to feel any of that, that's also great. Epidural is a great invention, so you do you do what's best for you do what's best for your baby, and I wish you guys all the best in your birthing experience. So if you found this video useful, please give this video a thumbs up, subscribe if you haven't already, and if there were any other things that if you have given birth before and have similar experience, or if it was something that I completely didn't even mention or went through, please comment below and share it so other moms can talk about it and read it, and I would also love to read it. Thank you so much for watching, guys. I'll catch you guys in the next video. Bye.